How are the results presented, David? By HPV type or positive or negative, or how will I, who has done this test?
Different countries have different ways of doing it. I'm quite simple and I call it yes, no, or try again later. So yes means you have a HPV. Now, some countries like Australia and New Zealand, they go into a bit more detail and they say if you've got HPV 16 or 18, which are the two that are much, much higher risk of cervical cancer, you'll actually just go straight for a specialist intervention. And with the other ones, we'll look at the cells of the cervix. Other countries, so we know that Scotland and I believe the Netherlands, just look at whether you've got any of those HPV types and then you go through that process. The no is they don't detect the HPV, and that's great. And then you won't have to come back until you're reminded by your national program. And generally that's between 5 and 10 years. The try again is if we don't have enough sample or there's something that's affecting our ability to test things. So the example I give is not really the cervical sample, it's the COVID test. And we often get COVID if someone's got a really mucousy nose. Sometimes that will actually, we can't actually run the test because the mucus blocks everything up.
How do we avoid unnecessary referrals?
Look, I think understanding the risks of each program. So we know that if somebody is underscreened, so that they haven't screened for 5 years or 10 years, they're at a higher risk of having a HPV infection, they're at a higher risk of having abnormal cells, and they're at a high risk of having cervical cancer. In Australia, one of the things that's actually changed in our program is that if somebody is underscreened, they'll be sent to referral before somebody who is a routine screener. Also, if somebody's over 50, if they have something that's abnormal, we'll send them to expert sort of referral before we would somebody who's 25. Because again, what your risk is depends on, your age and a number of factors. For instance, if somebody who's 20 and who's been smoking for 6 months has a persistent cough, we will probably not think they have lung cancer. If somebody who's 70 who's been smoking 3 packs of cigarettes a day for 60 years, we would treat those people differently. And it's the same sort of thing with cervical cancer and screening.
But it does affect the younger people, David. So this time you might look at it a little differently.
Yeah, I mean, cervical cancer for those under the age of 25 is very rare, and it seems to be a little bit more complex. So the WHO doesn't actually recommend screening until the age of 30. And part of the reason is most people become sexually active in that probably 15 to 30 years. And so they're more likely to be exposed to new infections. So we've done some studies, they're sort of subsets, so they're not the entire population. And as many as 46% of people between the age of 16 and 24 have a HPV infection at the point we test them. With our screening program starting at 25, it's 25% of people had a HPV infection. By the age of 50, it's only 6%. But those 6% are more likely to be those persistent infections. They're more likely to be infections that have been around long enough to start causing changes in the cells.
Is this given you've been vaccinated or you haven't?
So
does that make a difference as to when you screen?
It doesn't make a difference to when you screen. Australia has one of the most comprehensive vaccine programs, and we also had a catch-up program. So people up to the age of 26 could be vaccinated in 2007, which means we're in late 2023. The oldest people are starting to turn 43. However, that wasn't 80% of people. Even those who were vaccinated, it was only against 16 and 18. So those with the extended vaccine, we call the Gardasil 9, they weren't actually drawing our screening program till about 2030. So if you've been vaccinated, your risk of having HPV 16 or 18 is really much, much lower. But there are still, again, another 11 or 12 HPV types that can cause cervical cancer that we do need to screen against.